Hi guys, welcome back to my YouTube channel. It's your girl Precious and I'm back again with another video. So today the day is 24th November 2025. I disappeared from here for a long time. I was having that whole debate I think every small YouTuber has, should I quit this, should I stop this? But anyway, here I am, currently doing my general surgery rotation. This is supposed to be my last week, but apparently general surgeons are not like orthopedics. Orthopedics, once your time is up, they let you go. General surgery, they want to feel and evaluate to see if you've gained any knowledge. So it's like a whole thing. But it's supposed to be my last week, so I thought of bringing you guys along. And just a moment to just say thank you. We finally hit 1K subscribers. I think we hit a month ago, but I have been silent. So I'm just here to say thank you so much to all the new subscribers. Welcome. Thank you so much for making us hit 1K. It's because of you guys that was possible. So thank you. And if you are watching my channel and you haven't subscribed, please do. So the idea is to take you through this week, my last week in surgery. Surgery has been tiresome, very different from orthopedics. Orthopedics was tiresome as well, but then general surgery is like busier in my opinion. General surgery, yeah. So today was Monday. I was supposed to vlog, but I forgot. So hopefully I remember tomorrow. Tomorrow is Tuesday. So Monday, today we had registrars round. We saw some of the patients on the ward. So then tomorrow is theater day. Some of my friends will be on the ward seeing patients, but I'm a runner, so meaning I'll be going to blood bank and looking for blood for the patients in theater, while the other interns will be seeing patients on the ward. So bring you guys along. Hopefully I remember to vlog. But yeah, let's do a week together, a week in a life. I miss doing this. Let's do this.
First, ay, yeah, you making me new today. Brand straight from the fountain of wealth. I put my gift in your hand, take me from rags to riches in the best way. You wait for me, and it seems like you wait for me. Took me from rags to riches, oh yeah, and I love that for me. I love it, I do. Took me from rags to riches, yeah. Took me from rags to riches, love it for me. Yeah, I love it, I do. Took me from rags to riches, took me from rags to riches, oh yeah, and I love it for me. I love it.
Say hi.
Hi, how are ya?
Hi guys, so this is me making off time check. This is 15:35. Yeah, 15:35. It's 15:35. I'm hungry. It's like 25 minutes to 4 p.m. Yeah, so this is me going back home. So there wasn't much to show today, so I arrived in the morning, went to blood bank, checked on bloods at blood bank, and those guys were like, no, come back at 9 hours. So I went to the ward, found my colleagues, and then I discovered that I actually wasn't specifically the runner. There was no runner today, so then I had to help see patients on the ward. So I did that, helped see patients on the ward. Then with my colleague, we went back to blood bank. The bloods were not ready. Then they told us that no, the samples you bought for cross-match were not valid. So my colleague had to go back to the ward, withdraw blood from the patients, go back. Now we had to wait. So majority of my day today, I've spent it waiting either at blood bank for them to do the bloods, and also if it's not blood bank, then we're waiting in the doctor's call room for the bloods to be ready. So yeah, finally we're able to deliver some base blood to the patients. We had a patient we are suspecting her to have we're suspecting her abscesses in the abdomen. Yes, so she's jaundiced, she's been deteriorating, so they've taken her for an X-lap. Then we also had a patient for colostomy reversal and fistula. So yeah, we made sure, because the one we were very concerned about is the one with exploratory laboratory because we don't know what they're going to find. So just had to make sure she'd have that. But now I'm heading home. I'm super tired, but I'll catch up with you guys tomorrow, which is Wednesday. Hi guys, today is Wednesday. Today is clinic for the registrars and the bosses. So we are on the ward as the interns seeing the patients. Apparently that's why we're called house officers as interns, because we're supposed to be in the house, which is the ward. So yeah, we're seeing patients. We have a patient with an ulcer, decubitus ulcer. We're cleaning that. We also have a patient who's post-op for colostomy. So we're also reviewing her colostomy reversal. We also have a patient with a sigmoid tumor and AAA, aortic abdominal aortic aneurysm. And then yeah, we also have a patient who we discharged. She came in with dysphagia, so we did endoscopy, showed that there was a tumor. Then we did histopathology, showed that it was squamous cell. And now we just put, because it's now like occluding the lumen, so it's like complete closure. So we just put a gastrostomy feeding tube, and we're sending her for further management on the malignancy side, which is cancer. But yeah, so those are basically some of the patients we have. Haven't yet finished seeing the patients. We have one more. But yeah, welcome. Hi guys. Today is Thursday, and today is major ward round stroke audit meeting day. So today I'm presenting a topic: surgical site infection. My nerves are just running all around. I'm super nervous because I'm not one to enjoy attention like that, like where everybody's seated, and actually it's all the bosses and all the interns except students. So yeah, I was either supposed to present the audit for the patients or a topic, so I went for a topic instead, because they'll ask you questions on the patients, and if you don't know them, it's something else. But otherwise, that's basically for today. Yesterday I ended up stopping to vlog. I kind of had a bad day, but I actually even went back to the hospital in the afternoon to prepare for the same presentation due to short no electricity issues. So I had to go back to the hospital. I think I was coming back like 7 p.m. So yeah, let's do this day and hope for the best. Hi guys, today is Friday. Yesterday I didn't complete vlogging. It's hard, but yesterday after the audit meeting we had major ward round. Personally I think we had like 4 or 5 patients, but we discharged and remained with 3. We discharged 2, or we discharged 1. Can't remember, I'm tired this morning. But anyway, time check, it's a few minutes to 9:30. I'm late for work, but I went to town. Today is Black Friday, so I was trying to get a power bank because I needed one. I asked to report late for work, but now going to work. It's cold day, 24 hours. I will knock off tomorrow. I'm dreading it, but let's do this. And this weekend is a double call. So today is Friday, we're on call, knocking off tomorrow, Saturday, then Sunday we're on call, knocking off on Monday. So I'll bring you guys along, and yeah. Time check, it's 2 p.m. Yeah, exhausted. I think to prepare for a cold day, one of the things I think is adequate rest, which I didn't get this week. I have just been busy from one place to another, so I've been unable to rest. But yeah, so I'm tired, but I've seen like I think 4 or 5 patients since I came in late. I've seen 4 or 5 patients. I'm just from seeing she's got like a swelling in the breast. It's not a breast lump, it's a swelling just like above the the breast. Center for ultrasound. I also saw dysphagia. Center for endoscopy. I also saw ulcer on the scrotum, so scrotal ulcer. I sent him to urology. What else did I see? I'm trying to remember. I'm tired, yo. Also, when I came in the morning, I found my colleague had already collected a patient with a leg ulcer. Like, it was really, really bad. So, yeah, had to help clean that. But that's basically what I've been up to. Yeah, that's basically what I've been up to. Oh, I also saw a child with a hernia, non-reducible hernia. Yeah, the child has been vomiting and sent him to the pediatric surgeons because he will need a surgery. But otherwise, that's basically been today. This place is always busy. You will rarely have a free moment for like 30 minutes. They'll bring a patient, and there are so many. So yeah, it's busy, but wanted to keep you guys updated. Hoping to go and have some lunch soon. At some point, just after finishing my patient with the breast. After she comes with the breast swelling, she's actually a breastfeeding mother, and she's got a 3-month-old baby, and she says the swelling side just after that, and she has got pain in the breast area that radiates to the chest. So yeah, send the ultrasound to see what that does, and then we'll go from there. Thank you for watching my vlog.
That's a vibe. That's a vibe. That's a vibe. Only shake your presence, always so potent around me. I look like sunshine and wind. I smell like success and victory. You know I'm made in his image. Righteous genetics, I got it. To go with the this is my shot. I got you on my mind. That's a vibe. That's a vibe. That's a vibe. I got you on my side.
Guys, time check. It's 6 p.m. 6:33, 18:33. Just come back from eating. I feel much better. Maybe what was been wrong with me the whole day is just hunger, because I've just been feeling like the day is just dragging. So we are currently 8 interns. So we are like we find out that the same patients and others are not, and others are the same patients, the others are not. So yeah, just come back to casualty, sitting and waiting to see if any patients will come and just relaxing. Yeah. Takuyusa, say hi. How is Ko today? Ko is okay. It's okay because
we have rested for like 40 minutes now. There is no fire.
You don't jinx it on the word. You don't say such things. You're jinxing it. Anyway. Hi guys. Time check. It's like 9 p.m. 9:30, 21:30. And yeah, I had a patient from the time that I came back from eating my supper. I think I chilled for a bit. Then I had a patient who came in with a hernia. So this guy presented with urine retention for 3 days and constipation for 3 days. It was on physical examination when the hernia was seen, because they did, majority of patients who come with hernia will say, I've got a swelling, especially if it's in guano, like in the private area. This guy did not say anything, and that hernia was like we stumbled upon it, and it's a strangulated hernia. So he's going for OT, and I'm trying to do the runs, get some blood results and some full blood count and those basic.
They don't stand a chance, they can never compete. I know that I'm covered, your love is with me. 'Cause my God is real. Lord, I know they wanna see us down, but we ain't going out like that. 'Cause my God.
Hi guys, time check. It's after midnight. It's like 15 minutes past midnight. It has now become a tradition, like every core day. Like it has just become a tradition. I come almost every core day. I come for a cream donut from the canteen. I have a sweet tooth and I love sweet things, so it just makes my night. And there's just a little bit of hunger there, so yeah, I'm gonna have my cream donut and then go and take a nap. This is Sunday. This is the 20th. This is the 30th. This is the 30th. I think, yes, it's the 30th of November. Yes, so this is Sunday call. I was here yesterday. I left yesterday in the morning. I didn't say anything, so I ended up leaving in the morning. I think in the morning I remained manning casualty because when my friends got out for post-quarant, I'm normally the only one left in casualty in case any patients came. But yesterday the nurse didn't wake me up. Normally she wake me up and tell me you have cases, but yesterday she didn't. So I slept up to like 6 something. Then when my friends came back from post-quarant, I discovered actually 2 patients who had come and they thought there was no doctor in the call room. So the other one just had RTA, soft tissue injury, secondary RTA, but my other colleague ended up taking the patient because the one I wanted to take left against medical advice, couldn't find him. I think he got tired of waiting on the bench, which was sad. So yeah, currently just arrived at the hospital. I arrived a bit late today. It's 9:10 and yeah, I'm hoping I was supposed to get signed out tomorrow, but my boss changed his mind, so I'm really hoping to get signed out. So I'm just going to fill in my logbook for now because the bench is empty, there are no patients and my colleagues are like chatting. But otherwise, let's do this day. Hi guys. So we are currently filling in our logbooks because majority of us are supposed to leave, but then I remember that I carried my breakfast, so.
So guys, we are going to theater. We are going to theater
Hi guys, so time check, it's 20 hours, it's like past 8 p.m. I'm going to look for food. This is when we're leaving theater. So apparently the case finished like around 6 p.m. to, it was 3 hours, so we started at 15:44 or 3 p.m. 44 minutes past 3 p.m. and then it went up to past 18 hours, past 6 p.m. Yeah, there was almost 3 hours case. I think then afterwards we had to rush the patient to ICU. So the case was peritonitis, and when we opened up there was gangrenous omentum which they had to resect, and there was also perforations. So they had to resect the area of the bowel that had perforations and make an ileostomy because it was in the small bowel. So yeah, there was an ileostomy done. Yeah, so that was basically it. And they found when they opened up, they found the abdominal like area was full of waste matter. So they had to do also, they had to wash, yeah, do a lavage. So basically that was the case. And he was very sick. He basically had sepsis when they took him to theaters. Like he was super sick already. So after the theater, we rushed him to ICU. And yeah, sad case. Hope he survives. He's just 25 years old. So I really hope he survives. But anyway, I'm going to look for food now. I'm like super hungry.
I put my gift in your hand. Take me from rags to riches in the best way. Took me from rags to riches, oh yeah, and I love that for me. I love it, I do. Took me from rags to riches,
Hi guys, time check, it's 02. I came to the cafeteria to get my usual donuts. Today it's at 02. Kind of because I kind of had a kind of saddish evening. like, yeah. Also, the patient who were operating on in theater just heard the news that he's collapsed. He's passed away around 01. I feel so sad because he was so young, but then he was too sick. Like, that was us trying to save his life, but it didn't work. So yeah, sad. Actually, so that's something I need to talk about in this vlog, because I feel like this week we've experienced loss. Like, I think this week I've seen 2 patients like collapse that have been under our care. Like, as a doctor, I think most people, when a patient passes away, our focus is on the family of the patient and counseling them and all that. But guys, at the end of the day, the doctor needs counseling. Like, I think in surgery, I've come to realize that sometimes death, okay, even in cardiology, because I had patients in cardiology that would make me super emotional, like when I lost them, especially if I spent like a week or plus like caring for that patient. And one day, I remember there was a lady I once spent like time taking care of. She was, I think, in constant cardiogenic shock, and I literally ran around for her, even though I knew she had few more days left. And when she collapsed, I remember breaking the news to the family, because one day I just came for work in the morning. I found my colleagues resuscitating, and I joined with this resuscitation, and of resuscitation efforts, like, we did CPR, and nothing came forth. And I remember having to break the news to the family and going and just having a private time on my own and saying, okay, she's gone. Like, this is a patient I've cared for a while. So even just today, like, they say separate your medical life of your doctor life from your patients, but once now the death gets to you, like the death really gets to you. Like today, it's making me so sad to see a 25-year-old guy who's so young like collapse, and we lost another patient during the week as well. Yeah, so I just wanted to share that over here, that I don't know, sometimes as a doctor, someone works in healthcare, you need time to, I don't know, just go and do something else. Like, your life can't be 100% hospital. Like, you need time to detox, you need time to rest. If it means you talking to someone. There was another patient we lost, I think 2-3 calls ago, were called to resuscitate a patient, and it was the most violent death I've ever experienced. Like, the man had Ludwig's angina, and he was so violent before he died. We could not even take his vitals. Like, we were trying, he was fighting us. I think for me, he even grabbed my glove, and like, he had so much energy. And then in 2 minutes, the man was like gone. His body just became limp. And when we checked his pulses, we tried resuscitating CPR, we tried everything, oxygen, like nothing worked. The man was gone. And yeah, I just want to remind you, if you're in the healthcare, take time for yourself, take a minute for yourself. It means talking to someone, because for that particular patient, I remember even going home, the picture kept on playing in my head. Like, I was so traumatized. Like, the picture kept playing in my head and playing in my head and playing in my head. And I feel like sometimes you need to talk to someone. You need to talk to someone. Tell someone. I have people in my life where I just go to them and I'm like, yo, like, this happened today, and like, it's still playing in my head, or this got to me. And because sometimes talking to your colleagues, sometimes it helps, sometimes it doesn't. Like, I think the patient we lost this week, all my colleagues and I were just able to be like, okay, this one has gotten to us. Like, this has touched us. Like, we were hoping, like, we cared for this person for weeks, and we were hoping like she'll pull through and things would be figured out, but she's gone. But anyway, that's just 2 cents from me. I don't know, I hope this, I don't know, this was just me blabbing. But anyway, thank you so much for watching. I'm ending my vlog here. I've never ended my vlog before a night call ends, but I know there's nothing much to show. I think this evening I attended to one more patient after theater. I saw one more patient. She came with a fishbone in her throat, but my colleague did most of the management. And yeah, we just, because we couldn't sit on x-ray, so we were assuming that the bone just was like injuring her throat. By the time she left, we just helped made her swallow stuff. We did, of course, did the examination, checked if we could see anything. We couldn't. She was breathing quite fine. After we made her like swallow some solids, she was feeling much better. We sent her home. So yeah, that was literally it. Yeah, and today hasn't been very busy, it being a Sunday, but I'll end my vlog here. I don't think I'll pick up the camera again. I don't think there's anything much to show, but thank you so much for watching. Thank you for the 1,000 subscribers. Please, if you're not yet subscribed, please subscribe. My name is Dr. Precious K, and I create content about my life. And yeah, thank you so much for watching. I'll see you guys in the next time.